Tell us when you're ready.
I made it with Prince Ready. Right.
Oh, okay. All right.
Yeah,
So I tried to call your house phone, no answer. And then the cell phone that Mark has is disconnected. I said, no, how old is that cell phone? He goes, I don't know.
It sounds like being cell phone. Do you need it? You want me to give you
Yeah,
mine?
his ears are so plugged, he can't hear anything unless you scream. So I'll text him.
Good afternoon, everyone.
Good afternoon, everyone. Welcome to the Council on Aging Board meeting on October the 6th at 2:04 in the afternoon. Give everybody a chance to read their minutes over at home on their laptops or computers. Okay. Can I have a motion to accept the minutes then?
Make a motion to accept the minute.
Okay. Second, okay. So, now, before we go any further, I have an announcement today.
Nope,
You want me to do that yet?
you need to actually call for vote, all ayes, all in favor.
Okay. Any, all in favor, any motion, any opposed? So voted?
So close.
Everybody's yes.
Everybody's yes. Okay, so voted, we're all set. And before I go any further, I have an announcement to make before we start the regular part of the meeting. Any person may make a video or audio recording of an open session of a meeting or may transmit the meeting throughout any medium, subject to reasonable requirements to the chair as the number and placement of operation and equipment used so not to interfere with the conduct of the meeting. Any person intending to make such recording shall notify the chair forthwith. All documents be used during the meeting will be submitted in duplicate to the chair. Pursuant to the open meeting and public records law, all documents shall become part of the official record of the meeting. Anybody recording anything? I thought you were going to say yes. I thought you were. Okay, I guess we're all set with that. Okay. Treasury report.
Let's do Mike. Right at the very bottom.
Depends on how we play the meeting.
Okay, the treasurer's report is included in your packet. It's right at the back. We're very sorry that we would like to have every account be on its own page, but because of the accounts that are going into it now, we have to have 2 pages. So if you be patient with us, the first page up is the general fund.
It's very low.
Oh, okay. That again. Has everybody found the financial reports at the end of their packet, or if they ran it off from home?
They are numbered as well, so.
They are
page
numbered.
1, yep.
So bear with us, and we will try to guide you right through. We start off on page, it's called page 1. Page 1. That is our general fund, and there is one little error at the top of the one column, but that's no biggie. We have August 25 in the second column over, and it should be September 25, but that will be changed in the future. That they are September's figures. Okay, there's nothing much to report. Nothing, no changes in the main account, in the money that we get from the city. Are there any questions at all that anyone can answer? Everything is pretty standard there. We do have one contract outstanding a purchase order rather, and that's for the generator, $9,182. Otherwise, at the moment, we have a balance in the general fund of $168,838.25, and that's right where we should be. No, nothing else outstanding at the moment. Any questions on the general fund? This is the money we get from the city to operate.
Just a second note, the other purchase order that has been encumbered is the $10,533 for the mail site manager. So
Oh,
there are
I'm
two.
sorry, I didn't go up high enough, sorry.
And for all other accounts, that information is inserted into the bottom line, but not on this account. It's not taken off, it's not backed off, because it's already budgeted. But in other, you're going to see as we go on that any of the purchase orders is going to reduce the available funding. That's basically what we're doing and why we do that. So now you have a description of what it is.
Any other questions on just that on the general fund? If not, we will move on to the gift fund. During the month, we received a nice donation of $130, and so that brings our balance in the gift fund of $94,587.80. That is our ending balance. And I just want to remind you on the gift fund.
We don't have to remind them. The money that's been set aside?
No.
Oh, sorry. Yes, we need a reminder.
The gift fund is used for long-term items like fixtures and equipment. And even though we now have a healthy balance in there, when the move comes, I'm sure we're going to be asked, and the council has to approve any expenditures out of that fund. But I'm sure that we will spend some to make our new home more beautiful and lasting.
And what did we learn? Never question Terry. She knows, she's got the info. Thank you, Terry.
Well, sometimes you just, you forget. I forgot how to turn this thing. Okay, so that's all of page 1. The general fund and the gift fund. Everything seems to be in order. Okay, turn the page now over to page 2, and that is our revolving fund. And we started off with $31,923.85. We brought in some income from various programs, $5,683.86, and year to date we have spent $49,220.58.
No, we took in 49.
Oh, I'm
That's
sorry.
right.
See?
You got it. That's why we're here for that.
Income. So you can see all the expenditures under the September 25 column. We do have one contract, a purchase order outstanding, $19,000 for cell contacts, and $3,000 for Hannaford's, and I bet that's for turkeys, and $3,000 for McNally's. Those are the purchase orders, and they are in the purple column. And
then on the second page, the written one.
more on this. Oh, yes. And on the second page, which is page 3 at the bottom, it is a short page. Hanover Theater, we're under contract for $14,323, and for Wilson Bus, $2,332.08. So we have outstanding purchase orders of $41,655.08. And during this month, September, we spent $2,170.20. And year to date, out of revolving, we have spent $23,554.52. And at the moment, we have a balance of $15,934.83. Are there any questions on what any monies or anything was spent in the revolving fund? Yes, Paul.
Chicken like mine.
So we have 15,000, and that's supposed to last till June 30th?
No, money keeps coming in. It's a fluctuation.
Okay, it keeps coming in.
Oh, yes, every activity, money is collected and that all goes up in the income, right? Mike?
Correct.
Yeah.
Yeah.
All right,
Oh,
So then you
it's,
shut yours off.
yeah.
Yeah, it's a revolving fund.
money in, money out.
Yep, every month you're gonna see the income go up, and every month you're gonna see the expenses go up. So we may deplete the 15,000 if we have extraordinary expenses between now and the end of the year, but as programs are generated, revenues generated, offsets most of the expenses. So we certainly won't be in a deficit or be running behind in the revolving fund.
Yes, Paul? More, another question?
I was clear on that, I want to make sure we were on track with other years.
You didn't want to go out and be shoveling.
Some people may not know.
Okay, no, that's good, no, ask. Somebody else might have wanted to ask the question and wasn't afraid to, so that's good, Paul, very good. Anybody else? Anyone else?
I want to make a comment. When Terry and I were reviewing the financials, if you go back to your August financial report, you're going to see some of the line items have much larger expenses year-to-date than are reported in the line items for the September financial, and that's because in August we also showed you line by line the transfers, the general ledger transfers of expenses between the revolving fund and the grant fund. So if you try to reconcile the two without taking into consideration the very specifically yellow highlighted sections that show the transfer, you're not going to be able to do it. But in the August, we were very, maybe a little bit overzealous in showing every transaction so that there's a paper trail and tracking of those different general ledger transactions. Adjusting transactions. Okay, just so you know.
Any other question on revolving fund? Anything at all? Okay, moving on to page 4, which is our state, 24 state grant, and we had a beginning balance there of $13,239.25, and you can see only a couple of expenditures in September there, mostly supplies. And then the next column over is the year-to-date for all those different accounts. And on page 5 are your balances. The balance before the outreach coordinator's salary will eventually come out of this account, $4,036.33. So the balance after salary will be $5,536.14, and that's the 24-day grant, which we are working on getting closed out.
5 years ago, when we gave the financial reports, we included the outreach salary lump sum as a salary account line item. The problem with that is at the end of the day, if you took our financial reports and looked up in Munis what the balance was, it would be off, and it would be off the salary account, because they're actually two separate sub-accounts of the state grant. So, and I'm giving you the account numbers just to show the difference. One is the 52990, which is the general expenses, and the 51010, which is all salary-related expenses. We broke it up separately because it's easier for you if all of a sudden somebody went back and said, where does this number come from? You can tie the Munis number directly to the 52990 account, and you can tie the coordinator expenses for the 54-124 grant fiscal year 24 to that salary-related line item. Just so you all know, and we've been doing that for a couple of years, but people are kind of wondering, why do we have a balance before salary? Why do we have a balance after salary? The salary account is separate than the regular general expense 52990.
Okay, any question on the FY24 state grant? Then moving right along, we'll move over to page 6, which is our FY25 state grant, and this is the one that we will hopefully be working more on as we go through this year. In the first column, the purple, you can see all the purchase orders that we've got lined up. And a good part of them are the salaries for the instructors for the various programs. And it's good to have them all lined up there so we know, Mike knows that we have that money to pay them as their invoices come in. And there wasn't too much expended in September. Actually, in September 2,203.36. Oh, no, I'm sorry. 362.71. I'm sorry.
Nope, you're right. Yeah.
Oh, 2,203.36.
Is the salaries. Yep.
And now, the ending balance in our state grant is $33,570.69. Are there any questions on that one?
So once again, our monthly expenses were at $362.71, and you'll see in September 25 detail under Brisbane. I want to call the attention before somebody else does. It's a positive number of 200, not a negative number. That's because we issued a check in August that was returned, refunded, and the correct amount was reissued. So that shows the negative positive as opposed to the negative on that one line item.
And we have a question over here.
I have a question about the Lifeline.
Yep.
We're sort of in a trial period for a year on that. And can you tell me, where are the expenses coming from? And some of it's volunteer work that's being done, but what's the cost?
The cost is all equipment. I think it says Lifeline equipment in there. Let me just make sure. Oh, technology. So technology, Lifeline, that's equipment cost. So what we do is we get the equipment, we keep it in inventory, and when somebody subscribes, we're able to pull that equipment out of inventory and set up the installation immediately, as opposed to waiting for the week or 10 days that it takes for the equipment to come in. The second reason we have the equipment on hand is in the, I think, catastrophic event that somebody's equipment fails on them, and they own that equipment, we're able to give them immediately a new device so that they don't go a period of time without having the Lifeline coverage. And that's the whole idea of Lifeline, is to make sure that they have that continued monitoring. It's worked out really well for us. We only pay for the equipment and then we get reimbursed for that. So if you are on the go, there's $100 cost of that equipment. We buy the equipment, we have it in inventory, you subscribe, we take it out of inventory, we get the $100 back. Just like that. Yeah. So all of this equipment is, it comes back in on the revenue side. However, you should know, why do we have that? Any anticipated expense of over $1,000 to the same vendor for the same types of stuff, where we anticipated anything over $1,000, we're required to do a purchase order. There are additional procurement requirements. Over a certain threshold, we're required to get 3 bids. Over a second major threshold, we're required to 3 quotes. We're required to bid it, which is a public announcement with documents. We are able to do for service trade type work, that's plumbing, electrical, we can use folks off the state vendor list, so we don't have to bid it, only under a certain amount. So there are a lot of different restrictions and stipulations on how we purchase. But the most important things and why we're reflecting the purchase orders are, it's required in the city of Gardner, anything over $1,000 requires a purchase order. And the other reason is, if you want to tie this account out, like, I always think about, God forbid, I'm not able to be here, that some of my untimely demise, and somebody goes back and says, well, where the heck did these numbers come from? You can absolutely tie these numbers to Munis. So you can see the actual amount spent, because it says actual amount spent, and then it has a line item called encumbrances, and encumbrances are purchase orders that match up directly to the purchase order total at the bottom of the page. We update that every month as we start to draw down on these amounts. You'll see, for example, one of our line item for our vendors is $4,800. If I spent $200 this month, you'll see that line item come down on the purchase order is $4,600. We have to keep that real-time accounting because it's the only way to tie into news. So that's why now we have the detail on the purchase orders. I used to just have it as a lump sum, but now you know and can see the transaction history month to month on those POs. Does that make sense? All right.
Any other question? Any question at all? Ask, no. Okay then, moving on to page 8, last page. And that is a good one because there's nothing there. That's our FY26 state grant. So we do have a good amount in reserve. So the balance in that account is $89,136. And so we will be in good shape if we spend all of FY24. We'll try not to, but we at least have that. So are there any questions at all? No.
Okay, can I have a motion during the treasurer's report?
I make a motion to accept treasurer's report.
Second, okay, thank you. Any discussions? All in favor? Okay, any opposed? So voted. Okay, thank you very much, Terry, for the report. Very well done.
You're welcome.
Well done.
Next thing on our list is going to be the, under old business, the updates on new business from the prior meeting. And I guess Michael will probably tell us a little extra news.
I'm hoping that you were able to attend the information session that was hosted by the Senior Center for Mayor Mike Nicholson, Council President Tyros, and Councilor Hagelin to give us an update of Waterford Street. And it was really meant to be a comprehensive presentation to talk about all the different moving parts and what's happened in the last 5 years. I was delighted that they came and did that. I think a lot of folks had their questions and concerns that were more than adequately responded to. Since then, you need to know, we've gone through Waterford Street a couple of times for the purpose of really trying to define space and determine what work needs to be done from an aesthetic perspective or operational perspective before our impending move. And a couple of things I just want to note. First of all, I think the rooms are in great shape. The whole area over there really looks good. They're working hard on finishing up the bathroom renovations to get those operational. Heat splits are in, all of the priming in that entire wing has been done. First and second floor will only be on the first floor. The second floor is not operational. There'll be no senior center on the second floor of that building. But it really gives us a lot more space, and I think the opportunity to not have to turn over rooms as much, some storage space, a little bit of secure space, a hot tub room, no hot tub room, just kidding. But honest to God, the space really affords us a lot of opportunity. And I want to say, for those who weren't able to make that meeting, and I know there were several of you, there were a few people, there were about 100 people in this room for that information meeting. It was very well attended, and the questions that were asked by the audience I think were very appropriate and respectful for the most part. At one point, we went off topic a little bit, but we were able to get right back on topic and keep people focused on the purpose of the discussion, which was the Senior Center at Waterford Street. But one of the things that came up was this issue of water. And I've been a little tongue-in-cheek, joking about the fact that the school is called Waterford Street and not Dryerford Street. Because there's water. And there's water in just about every basement in New England. Any house that was built before 2000 has water in it. But what we've learned to do as New Englanders is mitigate that water. We've put in French drains, particularly relevant in Gardner with this French community. You couldn't call them Irish drains, they have to be French drains. We put in perimeter drains, right? And you probably have perimeter, or we put in sump pumps. And I have recently told the story about my wife and I going away in March and coming back to find 10 inches of water in our basement. And why do we have 10 inches of water in our basement? Because the sump pump got unplugged. The sump pump, when it's working, my cellar is dry. It's not damp, it's dry. And that's the reality of Waterford Street. When you shut pumps off and during the transition between the school and the city, things got shut off. There was water there 5 years ago. Now I'm telling you this today on October 6th as a testament to the reality of the situation. If this is something that's bugging you, last Thursday, I walked through the building again. And I climbed down the hole into the basement. And there's dampness in there. I'm not going to pretend it's the Sierra. There's dampness in there. But there is, we walked through that space. I walked through it. I wasn't up to my ankles. I was barely up to the sole of my foot in very, very certain areas. Like there were areas you could walk with no moisture. Like it was there. I think that this is important for us to start to counter some of the false reports that are out there, and maybe they're false because people just don't know, and they're assuming from their history 5 years ago, knowing that there was water and that there's still water in there. There wasn't, 10 million gallons of water pumped out of there and secretly in the middle of the night by tanker trucks. It just never happened. And as board members, you need to know that I am doing my work as a director to ensure that the facility we go in is appropriate, is healthy, is safe for our seniors. And a little bit selfishly, I have to say this, I'm in there. And you would think if I saw a risk, if I saw a health hazard, for my own self-preservation, I might say, no, we're not going in there. I'm eager, I'm willing, I'm ready to move in today. I'm so confident that this space is healthy and safe for us. I'm in this building for many, many more hours than anyone else. And that's a fact. We won't talk about how many hours, but for our typical senior, for a very active senior, maybe they're here 6 hours a week. I absolutely blow that number out of the water, as does Nancy, as does Berman. Why in God's name, it belays any kind of intelligent conversation for anyone to suggest that we would be okay with going into a place that had health or safety risks for us. I've been doing project management a long time for the city of Gardner, and we know how to mitigate, we know how to manage these kinds of situations, and I think that what's being done is super effective, very responsive, and this is going to happen, but it's not going to happen in the middle of the night without a lot of contemplative, decisive action being taken to make sure that we're able to go in there and operate efficiently, effectively, and in a safe way. So I wanted to just tell you that. I've included, just for your education, Councilor Tyros had some great imagery of what this center might look like. So here's a picture of it today. Here's what it might look like. And it absolutely spoke to the vision that this board has had for the last 3 years talking about this move, that it being a real homey space. Putting a little bit of AI touches on it really made it real for so many people in this room. The other thing he did, by the way, which I thought was great, when asked about the water in the cellar, the 5 feet of water in the cellar, he said, well, this is a picture of Mike Nicholson and I an hour ago in the basement of Waterford Street School, sitting on lawn chairs, legs crossed. So here's my phone, it's public information, it's a public document. You can FOIA it to make sure it's legit and that we didn't, mess with it, which is really cool. In that spirit, we might have some different uses. So I've included just a sketch of what this might look like for us from an operational perspective. I also want to address the fact that I think there was some misunderstanding on where the entrance for the senior center would be. The entrance for the senior center is on the same face of the school as the main entrance. It's not in the back of the school or on the side of the school. It's on the same face. So it's set back a little bit, but if you look at the front door, you'll see the front door of the senior center. And I think that's really important because folks were a little concerned that maybe there wasn't enough parking or the access was a little wonky around the back. I would agree with that, and I didn't hear that until after the meeting. So we've given you this idea of what it looks like and what our flow might look like. I think some of the really cool things it allows for us to do is have a separate computer room. We have a minimum of 6 brand new computers that have been set aside for the new senior center at Waterford Street. So we'll be getting rid of the 2 dinosaurs downstairs, have some really updated access, and it affords us the opportunity to build a technology-focused room. We'll have a consult room. Much to my chagrin, and I am transparent, so I tell people this, when I first started, we started during COVID, but I was eager to get the place opened up. We opened up, and one of the first calls I got was whether or not we were going to do pedicures in the senior center. I'm like, that's, it was a very popular service. You need to know, like, people were coming here having their toes clipped. What kind of freaked me out and absolutely, and I hope people hear this message because it ties into what I just said earlier, is the pedicures were done in our kitchenette. And I said, nope, I don't think that's healthy or appropriate for us to be doing that kind of service. And although I like doing the service, but we need to have a dedicated health room that we can, clean and sanitize in an appropriate way. This new design allows us to do that and maybe provide some services that either we had to stop or haven't been able to offer because of the lack of space here in the building. The conference space will be much bigger. We'll have 2 conference rooms, a small conference room for small meetings and a large room for things like our COA board meeting, which would be really nice. Private access rooms, but pool room. We're currently thinking about, because we have 5 pool tables, and designing pool table space, it has to be very specific. There has to be 7 feet between pool tables, and pool tables are 5 feet. So just looking at the dimensions, we really could only truly fit 3 tables in a room. But downstairs, we don't really meet that kind of industry standard now. So if we tighten it up again, we can put 4 in a room at Waterford Street with no problems. We have 5 tables. So 1 table would have to be out in the hallway. No. Either we open 2 rooms, because we couldn't put 5 in a room if we wanted to, with 3 and 2, or we are pretty confident one of the pool tables is on its last leg. And while it's great downstairs, as long as we don't move it, I think moving it might cause some problems. But we'll see. We'll deal with that when the time comes. So a lot of cool stuff. You have the concept in front of you. Any thoughts? I'm eager to hear your feedback. Like, Mike, are we going to do this? Can we do this? One of the things we're struggling with right now is our games. So our pitch and bridge games, pitch and cribbage games. Those games take 9 tables. They're tables of 4 feet. You have to have at least 4 feet. The dimensions are just a little short in these rooms for us to put the card games in. But we're going to see what that looks like down there. So we're going to go down with a couple card tables and just set it up, set the layup up, and see what it looks like from a real perspective. The cafeteria will be used for the bigger programs, like all of our exercise activity programs, our bingo program. If not the cafeteria, then the gymnasium. So a lot of stuff. Paul, then Stan.
I'm looking at the schematic here. I see the front door. I see doors over by flooring places. From a security point of view, those are the things that I think that whole area is secure. But I'm also curious if the other side of the building had doors on each classroom outside, is that going to be remedied in these ones too?
No. So there are no, so the elementary school side did have doors, egress doors from every classroom. That's very kind of old school. That's how it was built and constructed. They don't do that today. The doors, let's talk about that first. The front door, which would be the main access to the senior center, and the secondary door, which goes by the Growing Places offices, are able to be secured. So those are going to be able to be locked, latched, and secured during senior center off hours so that nobody has access to our space. There's actually a third set of interior doors into our space in that green area. between the line where it says door and that gray area, there's a door there that gives you full untethered access into the cafeteria gymnasium. That will be a secured locked door as well. We'll be alarmed and secure in our entire space. If somebody's using that facility at night, they won't be able to get into our space. It won't be open access. There are some back doors in the very right side. You'll see a blue pad, a blue box. That's actually an entrance into that conference room. And then as you come down from that blue box and that green conference room, there's a gray area storage, and then a green, WAP, and then the stairs next to it. There's actually an access door from the stairs. Now initially people were like, oh gosh, that's a long way to walk. It's about 230 feet, 250 feet from the front of the building to the back of the building, or it's even less from the front of the building to that staircase. So that really makes, if you split the difference, about 125 feet people would have to walk in an emergency to get out one of those exits. That is not precluding us, and we have not taken off the table the possibility of cutting into the walls of one of these rooms and providing a second means of egress on either side. So let's pretend in the crafters room we have one going out to the field, or in the library, one coming out to the field on that side. We could do that. It's not in the plans right now. One of the initial thoughts we had that might prohibit us from doing that are the unit ventilators. In schools, they have those wall-mounted units right along the exterior wall, and typically in old schools, it's one seamless line from room to room to room to room to room, which would mean if we wanted to break into those, we'd have to cut the unit ventilator, cut the piping, cut the wall, cut the windows, build a door, and then re-pipe that. That's not the case and I was surprised. I was under the assumption it was, but it's not. In every room, there is unplumbed wall space. So if we really determined that this was something we wanted to do for the convenience of our seniors and create that additional escape route, it would be a lot less of a construction project than I think we had first initially assumed. And a couple people will be poking to just come on some very small, with regards to the specific things you've asked. We'll bring you in to address those. Mary, you want to just hit your mic for me?
What about bathrooms?
Yep, so like I said, the bathrooms are currently being constructed. If you look at the schematic, go to the office space, the 40 WAP. See that white office space right at the top left-hand side? And come directly down, you'll see a gray area called storage, a white area next to that, Jan, and a white area next to that. That's a men's and ladies' rooms, so the full handicap bathroom stall in each of those bathrooms. And the number of fixtures we'll have in this space matches the number of fixtures we have upstairs now. Like, it's not less than what we have. In addition, around the corner where you see that 20 brr, that 20 brr are two additional bathrooms. Now those bathrooms are single stall, single units. We're not going to really open those. Our plan is to not really open those to the public. But they would be available for kind of unique and special circumstances. If a senior maybe needs a little bit more privacy because of an issue, and it happens here, maybe isolated for staff. They're not really set up to be fully, well, they are set up to be fully public, but where they're located kind of makes them a little wonky. So we'll probably isolate those for staff or for, unique situations that require a little bit more isolation and, protection of people's privacy.
I'll talk loud. Is that okay?
I can hear you.
Okay. Who handles our health and first aid? Citrus?
Who handles our health and first aid? Can you be more specific?
Like, when I was teaching, we used to have a first aid and medical supplies. So the student got hurt, we knew where to go, defibrillators, all that. Do we have a company that does that? Yes,
it's called the Senior Center Staff. We have 2 defibrillators. All of our staff, anybody who works here more than 19 hours a week, is required to have a current CPR and first aid certificate. We're trained on the AEDs, we're trained in choke saver, allergens, safe serve. Those are all required for our staff. Not only the staff at the Gardner COA, but the Gardner the CAC are also required. We have 2 defibrillators located in this building, on this floor and the basement floor. And we have 2 huge med kits. And by med kits, I'm not talking about the old shoebox of Band-Aids. A couple years ago, Gardner Rehab donated a unbelievably stacked and supplied med bag, first responder bag for the senior center that has everything you could possibly want and more. In fact, some of the and more we had to take out because it probably wasn't appropriate for us to have. But we have ambu bags for adults, ambu bags for children. Yeah, you name it, we pretty much have everything in this bag from a first responder perspective. We do have EpiPens, or we did have EpiPens, and EpiPens was specifically the thing that I said, maybe that's something we shouldn't have. We're not licensed or trained to administer EpiPens. Typically, somebody who has an allergy will have an EpiPen with them. If they have their own device, we can deploy it, but we don't carry it and store it. The other thing about EpiPens is they go out, they expire. So, for us to be able to, renew those, we don't have experts. They were given to us as part of the bag. They've expired. We've let them go. We're not going to keep EpiPens. That's our, And there were a couple other wonky things. We had glucose tablets, right? So glucose tabs we've used a number of times here. It's an absolutely appropriate, and there's really no contraindication for a glucose tab. Somebody who's not having a diabetic issue, maybe is feeling a little off, and they might think it is. If they took a glucose tab, it isn't going to hurt them, right? The sugar tabs. And by the way, they're really good. They're very, very tasty. Sometimes I pray to have low sugar so I can just eat like a handful of them.
So
They're really good.
So it's like the wood carving and the wood carvers.
Yep.
They get a.
We've done it. Yeah, so, the wood carvers, somebody asked about the wood carvers. We've had somebody drop a knife in their leg during a session here. We administered first aid and called the EMS.
They know where to get the Band-Aids or.
They let the staff know. So we don't have untethered access to emergency medical supplies by the public who aren't trained. That would be irresponsible. So if somebody came up and said, "Oh gosh, Mike just dropped the knife," and it's like we'd respond. We'd bring the bag down. We'd do the things we need to do to address the situation. And some of the other things that have come up, just like we had somebody fall out in the parking lot, and when she fell, her decided that her hands weren't the appropriate things to put down first. They just didn't, but you can imagine how ugly that looked. Our first respond bag, we were able to respond to that. We've had a number of falls, I can't even count how many, on the front staircase that have required us to come in and provide some intervention before EMS comes. So they come, once they're here, we walk. They are the trained people on first responder. We do the things that are needed to make sure those people are able to, be treated in the 2 minutes it takes for them to come down the street. So we've deployed it a number of times, from big stuff to little stuff. Yep. And we'll deploy the same things. Like we imagine having both defibrillators back on our first floor. We're going to have both of them there. But we're also looking now at trying to find funding and resources for nonprofits that are there to have those kind of devices situated in the other parts of the building. It's not going to be we're not responsible for that. It's not our burden to do that, but we're trying to do that because, for example, the council, the community action committees, they share our building, so they share our resources. They're going to be a little bit farther away, so we want to make sure that they have the same stuff. By the way, if you didn't know, we also have a biohazard response kit. So if somebody, biohazards are anything that contains human kind of elements. So you could imagine what that might look like. We're required by law to have that biohazard kit and be trained in that. Yeah. Any other thoughts or comments?
Yes.
Oh, did Stan have one? I'm sorry, Stan. And then we'll go to Mary.
I was wondering, where would you do the bread wrap?
We do the bread raffle in the gym.
In the gym?
Yep.
Oh my God.
That answered that so sad.
Yep. Yeah, either in the gym or, I'm sorry, with the cafeteria auditorium. Cafeteria auditorium is probably 2.5, 3 times the size of this room, and therefore 2.5, 3 times the size of the existing dining room.
And we could use the room down there.
Where they're gonna hold the health fair.
Yeah, if it's in the gym. Mary?
Question about the space that right now says possibly yoga and tai chi, which are quiet activities. It's right next to the cafeteria. We don't know yet how much noise is gonna come from that cafeteria. Is there a possibility like that where that ping pong tables, you've got maybe not set in stone in case you need some of these spaces for other uses? Are you open to that?
Yeah, every room, so with the exception of the ping pong table, well, that's not true. The ping pong table room, the pool room, the library, those are gonna have static furniture and equipment furnishings in them, right? So the library, you can imagine, we're gonna have bookshelves, we're gonna have some seating area. The ping pong tables are gonna have ping pong tables, and the pool tables are gonna have pool tables. We're not gonna be able to move those out and reset those rooms for other activities, but our fallback is the gymnasium. So we have a double wide gym in that space, and your concern is a concern that's been raised not only by senior center members, but by elected officials. They said the same thing. And, you know, appropriately, the best answer to that is let's get in and see. Let's get in and see what it looks like. Could you imagine, if you've never done or run or been part of bingo, imagine doing bingo with clanging pans in the back. Never going to happen, right? So, you know, we know that there are going to be some growing pains, and some of this stuff we talk about may not indeed happen the way exactly we think, but worst case scenario, if we can't do those quiet activities, and I would say yoga is probably one of those quiet activities. If it's too, you know, demonstrably loud or noisy in the cafeteria space, we'll move it to the gymnasium. Councilor Tyros and Mayor Nicholson have both separately but publicly said that, you know, it's a public building and the senior center has first priority on that shared space. So logistically, it creates a wee bit of an issue for us in terms of like how do we manage folks. If all of a sudden our program is going to be in the gymnasium, just separate door, separate entrance. You know, we're looking at some strategies to include computer on wheels, some rolling kiosks, which isn't impossible. These kiosks are all wireless. They're not wired into, they're not Ethernet based, they're wireless. They do require power, but we can have the same solution using a laptop. Put the same software on it, and it wouldn't need to be plugged in to do a rolling swipe in option for our seniors. So it's a little bit of a challenge, but not so much so that it's insurmountable. There's nothing, you know, it's different, and I think that's the thing we have to keep saying to ourselves, is it's different. So what we think here, we have to kind of stop thinking, because it's not going to be the same, which is good in some ways, right? So it gives us an opportunity, certainly gives us an opportunity to grow and offer more programs. I see Paul, there's smoke coming out of Paul's ears or something.
I'm on to the next thing.
No, I got Okay, going back to staircase,
Yes.
when you were down there, was there a smell? No.
There really, oh yeah, no, there really wasn't. And this is very personal. I am very reactive to smells, whether it's mildew or it's you know, body related, gasoline. I am very sensitive. I didn't find there was a smell at all. There was no offensive smell. In fact, one of the days I went through with a contractor, they were cooking something, and I was like, oh, this is going to be great. I'm going to just invite myself to lunch every day. They weren't cooking stuff in that way though, so they weren't making prepared meals for an individual. They were doing like big bulk squash or whatever the heck it was. I think the other day they made apple chips, which were really delicious. Not that I stole any, but I did. So, yeah, no, I didn't find that at all. Nope. And again, I was looking for that. I went in specifically, 3 months ago, and again this week just to see if anything has changed. Nope, there's no pervasive odor.
When I was teaching down there, we always called that the stinky hole.
The stinky hole. Well, yeah, maybe the stinky hole is stinky, and it could be because it's right in the right in the cellar hole. But I didn't find it, and I really honestly I looked for it. I even mentioned it. I'm like, all right, I'm gonna go check this out, and they were like, yeah, go ahead. So opened up the thing, checked it out, sniffed around, looked around, walked around, climbed around, did everything you could imagine, and I'm very confident that the details that have been provided by the leadership of the city are not erroneous and they're not misleading. And I'm telling you that very specifically from my own personal experience. I went down, and for folks that are watching this and have doubt, I hope that you will rely on what I hope it's the relationship we've established over the last 5 years, that I'm transparent. And folks that know me know that I tend to be a little aggressive. If there's something aggressive in the sense that I will follow up on things. I'm not going to just let something go. If there's a problem, we're going to address the problem. And I will keep bringing it up, right? So maybe that's passive aggressive. But everything so far we've asked, they've done. Anybody else want to pipe in, share anything?
I just asked a question. The room that you thought you might be able to use it as an egress, would that just be for emergencies only?
I don't know which room you're referring to.
This one big.
No, it can be any one of those, Ron. No, I wouldn't say that we're dedicating the library. I made that as a for example. I'm not proposing that a wall be cut in the library for an egress. It could be any, if we decide we need it, we're going to look at the best room in the best response to that need, whatever that need is. So I'm not at the point of saying that we are absolutely committed to doing that. I'm saying that if it becomes an issue, like the issue we had downstairs with the broken sewer pipe, like the issue we had with the air purifiers, we will be as adamant and persuasive on making that happen if it needs to happen. But right now, I would say it's not happening.
No, the reason I was asking is because that whole area down below that is all green grass area. I know we talked about having a gazebo or something that's not, that would be a spot to have it in the sunny area on that side of the building, on the south side. And if you have to open up anywhere, those rooms and put a door in, that would work for people at least. And I thought with the library room, if you get a book, bring it out and sit and read if they want, whatever type of thing. Yes. So that's why I asked and take that specifically.
I don't disagree, but I just think that discussion is way too preliminary for us to have. And I think that people get a little, thinking when we start making plans that aren't necessarily needed. It costs money, and what we really need to do is get in there. And then once we're in there, we can kind of feel out what additional needs we have. Anybody know what a WAP is? WAP. Do you see WAP all over this? It says WAP, 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 WAP. Anybody know what it is?
Wireless access.
It is, yeah. So we're proposing what the wireless access points are. So I did that when I sent this, I sent it to our tech person, just for the idea of for coverage, WAPs now are shorter distance but more power. So you need more of them, but you get faster speed. And we could do 2 WAPs on that whole side and cover it adequately, but we're going to put, I think, 6 to 8 WAPs on our side alone to ensure that we have good internet access. Bring it way down.
So HW is hardwired?
HW is not hardwired. Yeah, you're way too high. So if you're not using your mic, Terry, you want to shut your mic off? We're getting feedback. And the mics are set super sensitive so that when you speak, it will pick up. But I imagine people who are watching this now are going to be pretty upset that they hear that squeaking, more upset than you. So yeah, HW is hardwired, and we're gonna hardwire the laptops in the library. So initially, the technology would be in with the library like we have downstairs. That's changing now. We're gonna put the technology in that far right green room next to the conference room, or vice versa, flip the consult room and the tech room. So that we'll have a dedicated space for technology. And that will be hardwired. That it? Yeah, it was a good discussion.
Very good. Okay, next thing on our list is new business. Michael did a pretty good job already, so I don't know if he's gonna have a report.
I hope none of you have an appointment at 3:15. No. What I really wanted to tell you, Mr. Chairman and members here, is, I think this year has really given us cause to look at what value the senior center has, other than being a great place for seniors to have social connection, and helping other people understand that impact. We do a lot of activities and social programs. That's a fact. But those activities and social programs have more than just a recreational purpose. 3 years ago, when we kind of redefined our mission to connection and purpose, it really spoke to the idea that there are a lot of seniors out there that are isolated and lonely. And that can have these really consequential adverse impacts on their mental health and physical health. And so how do we, as a city body, address the health needs of those seniors? And so clearly, interaction, connection, recreation, social programs is one way to do that. But I wanted to give you this summary. I afforded the opportunity, twice a year we go before the City Welfare Committee at the very least to give an update on what we're doing as departments under the purview of that committee that we're assigned. And we are assigned the Welfare Committee for the City Council. So I'm going to put the City Council and offer this update after doing a lot of work. And so when we submitted our annual report to the Executive Office of Aging and Independence for fiscal year 24, we registered about 4,000 unique individuals. We had about a little over almost 960 volunteers who did about $300,000 worth of work that they donated here. That's using a very conservative estimate of between $15 and $18 an hour, not at $150 an hour for volunteers, although you can assume that the nurses and the doctors and the pharmacists and the financial planners and the lawyers that gave their time so freely to the Gardner Senior Center certainly make more than minimum wage. Those were all FY24, and I explained to the City Council, those numbers are going to change for FY25 and FY26. If you remember what was happening between June of 23 and July of 24, we were doing a ton of COVID clinics, and we were doing the migrant response unit, and we had a lot of kind of these ambient activities that maybe would be unique, but not necessarily have been unique, but might be considered unique. So that drove up the number of individuals that we served that year remarkably. Our number this year is going to be probably pretty close, but not hit the 4,000 mark. We did 350 meals for Thanksgiving and Christmas, right? So that's 700 people that otherwise weren't connected during two of our community's biggest holidays, pretty significant. We served 1,100 people, which was great. If you came to the National Night Out in Gardner this year, 1,100 pieces, burgers and hot dogs went out to the community. We had a line at any given time of 60 to 80 people for the Gardner Senior Center Suicide Prevention co-sponsored tents. We had our own tent set up with Gardner Senior Center members handing out with collateral materials and items to folks that came by, and at the very least it gave us a heck of a lot of exposure. But here's the real bread and butter stuff. The Gardner Senior Center has created connection and has helped register and enroll 430 seniors into the Senior Buy-In Program. The Senior Buy-In Program is a Medicaid program, and in part, one of the many benefits Senior Buy-In does is it eliminates the $187 co-pay for Part B of your Medicare insurance. Eliminates it. So that means every month $187 went back into the pockets of seniors. Not pretend, not value-added, real money, $187, 430 seniors, 12 months. That was $964,000 of real money in their pocket. In addition to that, about 10% qualified for the senior buy-in, the low-income subsidy to the senior buy-in. The low-income subsidy allowed them to save $264 per month on their Medic's plan. It also eliminated the high-cost drug copay and reduced their overall copays for prescription drugs and hospitalizations and doctor visits substantially, from $50 and $25 in the tiered to $15 and $5 or $10 and $5. I can't possibly give you a number for what people's co-pays and hospitalizations were, because I don't know each of them individually, and I don't know what they were, but I can tell you this: for $267 a month, 43 seniors, 12 months, gives us another, I don't know, $136,000. Between the senior buy-in, the low-income subsidy, that saved seniors, put in their pockets last year over $1 million. Like, I never thought of that in terms of these numbers, but these are huge. In addition, that annual copay for high-cost medication was estimated at about $86,000. We gave out $15,000 in farmer market coupons over the last 2 years to seniors. Those farmer market coupons are treated like cash, allowing them to go to farmers market and fruit stands all over this great and glorious Commonwealth and buy fresh produce and fruits at no cost to them. We enrolled about 54 seniors last year in the SNAP and HIP program. SNAP and HIP, Supplemental Nutrition Assistance Program, HIP, Healthy Incentives Program, affording them additional funds for their budgets, the budget-conscious seniors that we have here. That gave them, by the way, an average benefit of $215, gave them another $134,000 in their pockets. Not fake money, real money that they're going to Hannaford's Price Chopper, Walmart's, Shaw's, Market Basket, and spending to supplement their food program. We provided 30 individuals enrollment in the RAFT program, providing them rental assistance for over $210,000. Our Vet-to-Vet Cafe, and this number I was a little surprised about. I had the opportunity to speak with Corey Hasselman, who's now the former VSO for Gardner. They connected at least 40 veterans to the VSO in Gardner that had not been connected before through our Vet-to-Vet Cafe. So they met them here, they enrolled them here, and those veterans received a benefit of between $175 and $4,000 a month. Well, I'd love to say they all got $4,000, be able to report that out, but I didn't. I said, all right, at the $175 lowest amount, that equals $84,000 of benefits, real dollar benefits, in the hands and wallets of the veterans that were participating here, and gave them an average of $2,600 in Chapter 115 benefits, which, by the way, is 100% contingent upon the percentage of disability, of service-related disability they have. So at 100%, they get $2,600. At 5% of service-related disability, they would get 5% of that. We made about 10,000 calls last year, and we get in 10,000 calls. And how do you're asking how do you figure that? Well, I get a report every month. I've asked, and I'm probably one of the only departments, with the exception of VMS, that tracks that. What's our call volume? Our VoIP management system, our company, sends me those reports. In last year, we did about 10,000. It was like 9,820. We made 10,000 calls, and those 10,000 calls include robocalls, right? But we've only ratcheted up our robocalls from there. We haven't ratcheted them down. So that 10,000 number, if you include every single time we send out a robocall, that's 2,600 calls we make in 30 seconds. With highlights and information that gets people connected, pretty significant. Our Facebook page has received almost 40,000 views, which by any metrics for a senior center is huge. We have a reach of over 6,300 people. We have likes of over 700. We have followers of almost 1,000 people that follow every single post that comes out. Our Google profile has seen 2,700 views in the last 6 months, 27 in the last 600, which allows them to make calls right over their computer to us, or have access to directions or programming. And, which is kind of cool, this will probably get a lot of people to go in and change my ratings, but my Google ratings are 4.7 out of 5, and my Facebook ratings, the Gardner Senior Center's Google ratings are 4.7 out of 5, and Facebook is 5 out of 5, which is pretty good. We recycled 3.16 tons and that's Ron trying to tell me I'm done. 3.16 tons of paper, 12,000 pounds of textile. If anybody's wondering where I get that number, that comes directly from CMARC. CMARC picks it up in a truck, they bring it and they weigh it. And why do they weigh it? Why do they care? Because they pay me 7 cents a pound. So they want to know exactly how many pounds are coming in from the senior center so that they don't overpay. 12,600 pounds of textile, and we recycled almost 1,000 pounds of electronics from our community. We did about 18,000, almost 19,000, $18,750 worth of tax returns last year, which we are on pace to do again this year easily, and provided about $50,000 worth of transportation services just for the medical transportation program that's managed by the CAC. The 547 unique individuals taking advantage of the senior medication medical transportation program. That doesn't include the many hundreds of people that we subscribe to the MART senior transportation or paratransit. Those are huge impacts, and it took a little bit of a kick for me to start to put together like what really is the impact that we have on the senior center. So as a member of the Council on Aging, you need to know that you have a very important role to play, not only for the social welfare and the mental welfare of our seniors, but as this paper demonstrates, the financial welfare and well-being of seniors in our community. I'm really excited about it. Can you imagine? So I got asked, how many staff do we have? I'm going to share that with you as well. For those of you who don't know, we have 3 full-time staff, myself, Nancy, and Berman. Nancy is administrative assistant, administrative coordinator. She helps me with the programming side of it, and Berman is our facilities person. He takes care of helps me with the plant side of it. Nancy and I work as a team, Berman and I work as a team. We're lucky to have some volunteers that help with some of the heavy lifting, some unbelievable volunteers. In addition, we have a couple part-time people. We have Karen, who works 6 hours, Ann, who works 12 hours, Anita, who works 8 hours, and Lauren, who works 15 hours. Those are paid people who allow us to plug in a second person in the office to make sure we always have 2 deep staffing and leadership at the building at any time. And that's really important, especially for protecting not only our seniors, but protecting our staff. Then we have a cadre of administrative volunteers who, but for them on the Fridays when people are taking days off, we would literally have to close down. Imagine on a Friday or Monday morning how busy that phone is with 10,000 calls. It couldn't be done without those folks. And I am super appreciative of them. And so when asked that, the counselor asked, and I applaud them for having the insight to ask this question. He said, well, who does all of this case management stuff? Who does the advocacy and the follow-up calls? And that's me, that's our staff, that's it. We don't have outside people, we don't have paid social workers. We do that. We pick up what we need to pick up to get the job done. I also want to make sure that you understand, I mentioned volunteers and how important they are to us, and I say it every time I'm in front of the seniors. Volunteers at the Gardner Senior Center drive this engine, 100%. We'd be dead in the water. We could not do 1/5 of what we do without the volunteers here. They are incredible, dedicated, beautiful people, and we're so appreciative. In our partner organizations, we talked about the COVID clinic. We were doing 800 people at a COVID clinic here at the Gardner Senior Center. When we were partnering at the PACC, we had 27,000 calls in a minute. Like, people were coming from all over New England. But for our partners, our healthcare partners, our community partners, our assisted living partners, our food pantry partners, our utility partners, in so many ways. Today we needed some services for a hearing impaired person. We were able to call a partner and get a interpreter that did sign language over Zoom for us. Where would we have been with that sooner if not for that help? And so again, I can't ever express my gratitude in words enough, but I hope you join me. I think if enough of us let people know how important the work that others do are, they'll feel the appreciation and gratitude I think we all feel. Take a breath.
Get your glass of water.
No.
Thank you very much, Michael, for that report. Next thing on our list is open discussion. Okay, Gary.
I just want to mention, this is from the future, maybe in 2026. I really think that you should set up a bylaws committee to review the bylaws, especially the fact that we're moving to, but there's a lot of things to do, all the new members and everything. So maybe in 2026, that could be on the agenda for you to start up a review of the bylaws.
Maybe we should look once we're in the building, we know what we're doing.
Yeah, if you want to just reiterate for people we didn't hear.
Terry asked that we go, she had gone through the books